Hello guys, Rahul here. Welcome to our channel Doctors to Be. In the last video we discussed about Mycobacterium leprae. In this video we shall discuss about leprosy. Leprosy is a disease caused by Mycobacterium leprae. So leprosy is a chronic granulomatous disease which primarily involves skin, peripheral nerves and nasal mucosa. But it is capable of infecting any tissue or organ. So leprosy is a chronic granulomatous disease which primarily involves skin, peripheral nerves and nasal mucosa. But is capable of infecting affecting, not infecting, affecting. I mean to say it can affect any other tissue or organ Okay, and it is classified into four types. Leprosy is classified into four types. So this is the definition, and is classified into leprosy is classified into four types. Okay, the two extreme or polar forms are lepromatous tuberculoid and other two are dimorphous and indeterminate. So let's first discuss about lepromatous and tuberculoid leprosy in a comparative way so that we can compare in both. So let's draw a table. With lepromatous on one side and tuberculoid on the other. So let's discuss a bit. Lepromatous occurs in immunodeficient individuals, while uh, in tuberculoid patients the immunity is adequate. And in lepromatous, actually the type of leprosy is determined by the status of the cell mediated immunity, because the cell mediated immunity is the one which is able to kill the leprosy bacilli, lepra bacilli, and the humoral immunity do not have any deleterious effect. They cannot kill these lepra bacilli. So it is the cell mediated immunity that matters actually. So let's discuss. In lepromatous, what happens is large number of bacilli are present inside lepra cells or even extracellularly. And in tuberculoid leprosy, the bacilli are scanty and less infective. Okay, and lepromatous is more infective than other forms. Okay, rest of the other forms, dimorphous and intermediate, even tuberculoid, it is much more infective. So in case of lepromatous, as I discussed earlier, CMI, which is cell mediated immunity, is deficient. But in case of tuberculoid, CMI is, let's write just CMI as I mentioned over here, CMI is adequate. In lepromatous, there is lepromatous leprosy, there is extensive humoral response, but and there is production of large number of antibodies, and both type of antibodies are produced, autoimmune and mycobacterial. So extensive humoral response, but in case of tuberculosis, humoral response is less and humoral antibodies are rare. So humoral antibodies are rare. Okay.